Hello, I'm Ashley Cole and I'm the Center Director here at the Surgery Center. I just want to talk to you today about the procedures that we do here on a daily basis. Our most common procedures here at the Surgery Center are injections. Probably our most common injections are epidural steroid injections, commonly known as ESIs, or medial branch blocks. We do both of those injections on a daily basis. Some concerns that people do have with injections are they going to fill the needle? We do provide a local anesthetic with the injections. It's just a small needle stick. A few seconds later, you should be nice and numb where you don't actually feel the needle going into your back.
So if somebody comes in and they have a bulging disc, they generally complain of pain that radiates down the leg or shoots down the leg. Late findings are weakness and numbness. So what we'll do is we'll go in under x-ray down at the surgery center and we'll put a little bit of local anesthetic and some steroid on the back of the disc and that nerve to try to heal the disc up and try to shrink that disc actually. We go into the epidural space and we put a little bit of local anesthetic and a little bit of steroid. We'll usually do 3 procedures, 1-2 weeks apart, total of 3. And it really helps a lot of the disc bulge and the inflammation around that nerve, and many patients get better.
Another common question is if we offer sedation for injections. We do not do IV sedation for injections, but we do offer a small oral sedative to help take the edge off if you are nervous at all about having the procedure done. Once you arrive at the surgery center and check in at the front desk, we will bring you back to the pre-op area where we will check your blood pressure. After that, we bring you into the procedure room, and once the physician is in the room, it only takes about 3 or 5 minutes to have the injection performed. Afterwards, we take you into the post-op area where we will get your blood pressure again and go over any discharge instructions with you at that time. And it is also important to remember that you will need a driver the day of the procedure. Some things to remember after your injection are that you can be sore at the procedure site for a couple of days. An ice pack will help for the first day, then you can switch to heat the following day if you need to. Also, it does take a couple of days for steroids to kick in if you are receiving an ESI injection. Medial branch blocks do not have steroids in the injection, therefore you should notice some relief as soon as you leave the building. One thing that patients are very nervous about is if the procedure is going to hurt or if they're going to feel any pain at all with the injection. The nurses here are wonderful. We've been doing these injections for over 20 years, so they are very good at making sure that you're comfortable and tending to your needs. Also, the physicians are aware that people are nervous and they're really unsure about these injections, so they do the best that they can to make everyone feel very comfortable. We also do the local anesthesia, which should get the area nice and numb before we do the actual injection itself, which does help.